Good morning, Europe. Good afternoon and good evening to our friends and participants from around the world. We are coming to you live from the city of Best at the Philips Customer Experience Center in the Netherlands, and we are going to use this stage as a launching pad for the next 2 days for the BigMedilytics launch and kickoff. On behalf of the entire organizational team, I'd like to welcome you. And we're going to be bringing you live not only from here, but from across Europe with some of the world's leading scientists, clinicians, thinkers, not only from private sector, but from public sector. And we have a jam-packed event for you today. And the program will basically focus in on launching the BigMedilytics research program to improve people's lives for the European citizens. As we go forward, I'd like to thank our friends and partners, not only at the organization team here at Philips, but in Cleva VLC for setting this up. And in order to kick off the event officially, I would like to bring Dr. Supriyo Chatterjea to the stage. He is a senior scientist at the AI, Data Science and Digital Twin Department at Philips Research, but maybe more importantly, he is the project leader for the BigMedilytics program. Supriyo, I know you speak on behalf of the entire research team, so let me ask you to do the official welcome and formal opening of our event.
Thank you very much, Kurt. Consider a patient who has had a kidney transplant after 8 long years of waiting. And imagine if the kidney was rejected soon after, simply because the situation was beyond repair by the time the patient arrived at the hospital. Kidney rejections happen in nearly 30% of cases. But what if doctors could remotely gather data from a patient's home and use predictive algorithms to identify patients at risk of developing complications as well in advance to prevent such life-threatening situations? Or let's consider the dilemma faced by doctors treating prostate cancer. How do they strike the right balance between removing the entire tumor and preserving the critical structures that are so crucial for controlling continence and potency? What if damaging the critical structures around the tumor leads to lifelong incontinence? Surely that will have a severe impact on the quality of life of the patient and his mental health. And what about the tens of thousands of euros which will have to be spent on diapers or pads for the rest of the patient's life? Well, imagine if we could have a dashboard that integrates all the data that's needed to help clinicians decide on the best strategy for performing surgery. And what if that dashboard could go a step further by using AI algorithms to predict the longer-term outcomes of a patient for a particular type of surgery, not only from a clinical perspective, but by taking the human elements into account as well, quality of life and long-term costs of care. And speaking of human elements, while it's common to speak about the quality of care of patients when it comes to healthcare, we often forget about those who are responsible for looking after the patients. Nurses, for example. Let's consider some figures. Approximately 38% of nurses suffer from burnouts annually. 28% of nurses quit within 3 years. And did you know that nurses can spend up to 30% of their time just searching for equipment? You simply can't blame them if they get frustrated, isn't it? Imagine if we could have a system that completely eliminates the search time through the use of real-time location information so that nurses can focus on what really matters, having time to provide patients with quality care. Well, actually, there's no need to imagine anymore, because the 3 examples I just described are among the pilots that we have in the BigMedilytics project. Having received 15 million euros in funding, the BigMedilytics project is one of the largest projects to have been funded by the European Commission dealing with the use of big data in healthcare. The primary objective of the project is to demonstrate what it takes to scale up the use of big data solutions across the healthcare sector, covering healthcare providers to health technology and IT companies, to payers, pharma, research institutes, and universities. To demonstrate this, over the past 3.5 years, this consortium, consisting of 35 partners, has executed 12 pilots covering a diverse set of topics across 3 themes: population health, oncology, and industrialization of healthcare, which essentially refers to the optimization of workflows within hospitals. What's important to highlight is that all the pilots have been deployed in real clinical settings, and this is the unique aspect of BigMedilytics. Often, there's a tendency to think that big data projects are just about applying the latest AI algorithms to large data sets, and that if your algorithm performs well, you have a winning solution. But healthcare is very complex. Rolling out successful big data projects in the healthcare sector at scale requires intense collaboration between people with highly diverse backgrounds who usually don't collaborate with one another. I'm referring to clinicians, patients, data scientists, hospital decision makers, IT personnel, policymakers, and even lawyers. But this is exactly what we have done in this project. However, it definitely hasn't been smooth sailing. Communication was initially a huge issue. We didn't even understand each other's lingo. GDPR was a tough nut to crack. Scientists, who usually just stick to research, had to understand how to tackle real-world problems, like change management, for example, when deploying AI-driven solutions in healthcare settings. Or what happens when a patient starts entering fictitious data so that they can just avoid a visit to the hospital? Yes, that actually happens. But one thing is for certain. As a consortium, we have definitely learned a lot about what it takes to roll out big data solutions at scale across the healthcare sector. And the good thing is that we have captured the learnings of the project in what we refer to as the BigMedilytics blueprint, which you will hear about today, so that others can benefit long after our project concludes. Over the next 2 days, we hope to captivate you with several invited talks, panel discussions, presentations, and demonstrations showing the different aspects we have covered in the various pilots. We hope you enjoy the program, and we look forward to having an engaging session with you. But more importantly, we hope you get inspired by our learnings so that you yourself can play a role in scaling up the use of big data in healthcare. Thank you very much.